from Taiwan. My name is Zenei NNU. I'm from Taiwan Nurses Union representing, and we are joining the Global Nurses United, the assembly. We are working for Medicare for all, and in solidarity, supporting all other nurses. Actually, we have nurses representing 24 countries.
So what is it like being from nurses from all over the world coming together?
It's so good because we are supporting each other, because we are facing some of the similar issues and problems. For example, working conditions and overload in
Outsourcing, privatization. You have national.
Exactly. But also we have our local problems, and we are in solidarity, supporting each other.
And China used to have health care, but it's been privatized. What's the healthcare situation in Taiwan?
Taiwan, we have national health insurance system, so it's very good. Satisfactory rate is almost close to 95 to 98%. So it's wonderful. It's a wonderful system. Although there's some impact on our working conditions, so unions is working on that, trying to improve nurses' working condition.
How are your working conditions being attacked? How are they attacking them?
Because accessibility, our system is a kind of patients can have access to any, for example, physicians and medical centers. So when they are sick, the accessibility is so free. They go everywhere. So that's why increased loading for the care providers. So, which means that our work is overloaded.
And China, socialism with Chinese characteristics. What's going on there? There are a lot of people who are attacking doctors in China. They can't get health care.
Right. I don't know that much about China. So, but Taiwan, of course, the workforce violence is there, but I'm sure it's okay. The government has been doing something, although we are not satisfied as a union member, that we are not satisfied what government is doing, because they should do more to have the hardware, you mean the structure of the building and medical emergency room have changes, all those. They need to do more.
And what percentage of the healthcare workers are unionized?
Very low. As a country, actually, we only have, all the industry is only 7% of the labor union, the laborers are unionized, only 7%. It's very, very low in Taiwan. So we are working on that either. Also, the government needs to do more.
I'm with the president of the Korean Health and Medical Workers Union of South Korea. Welcome, Sun-ja-na.
반갑습니다. 감사합니다. Thank you. Nice to meet you.
So maybe you can talk about the conditions and the issues that Korean healthcare workers face and your union.
There are several issues. First of all, what we focus right now is to expand and improve the coverage of the health care that is provided to the people. And the second issue we are facing is that, unlike the popular belief, actually only 10% of the healthcare provider, such as hospitals and clinics, are public. So 90% of those hospitals are actually private companies, although they are nonprofit. So we are trying to expand the percentage of the public healthcare providers. And third, we are trying to improve the working condition of the hospital workers and the welfare of those hospital workers.
And has your union been engaged in a struggle to organize these so-called nonprofit hospitals, and what are some of the problems in trying to organize these nonprofit hospitals?
The biggest problem of these unorganized hospitals have is the discrepancy in the wages. they have a very low wage level compared to other hospitals that have been organized. Also, these hospitals have insufficient staffing, so they only hire a small number of workers, and also the welfare of these workers are very, very bad compared to the hospitals organized by the union. A lot of nurses do not have maternity leave, and a lot of workers do not get vacations. Also, another very serious problem is the abuses these owners and management, exercise against the workers. So we are trying to organize and unionize these hospitals. And as these hospitals are unionized, these problems, they improve a lot.
And the issue of temporary workers yeah, in the United States, temporary workers in Korea, Japan is a growing problem, that more and more workers are temporary workers, so they don't have any rights. Is this a problem affecting the healthcare industry and your members?
It was a serious problem up until the previous administration. A lot of hospitals actually outsourced many workforces when it comes to the employees in the kitchen or janitors and security, even nurses. However, after the administration changed, after the candlelight revolution, this new administration under Moon Jae-in declared that Korea is now going to accomplish zero temporary workers in the public sector. So we have been struggling to change all the temporary workers in the public hospitals to regular workers, and we have been improving the situations. And in the same trend, we're also trying to make these changes in the private hospitals as well. However, one thing needs to be noted, that although the government has declared such policy to make it zero of the temporary workers, the public hospitals are resisting a lot. And what they are trying to do is to establish a subsidiary company to hire these people instead of hiring the workers directly. So there has been a lot of struggle led by KHMU, along with these national university hospitals and other public hospitals, to force them to hire workers directly. For example, there is one president of one of these hospitals who went on to hunger strike for 1 month. So the fight is still going on.
The issue of privatization of healthcare, where the workers really and the public have no control. It's run by private industry. Is this a problem in Korea, not only in the hospitals, but as far as drugs and medication and other services?
It is the same in Korea as well. I made a presentation in the morning about the privatization efforts that was attempted in Jeju Island and our struggle to stop it, which was successful. And because the hospitals and the corporations always try to find an opportunity to privatize the medical sector. In Korea, it is a constant struggle. However, with our victory this time, I believe that their attempt has been defeated, at least in the sense of the privatization of the hospital. However, now they are increasing their efforts to privatize in the sectors of the medical equipment and the pharmacy area, especially those biomedicine, such as like stem cell medicine, or the vulnerable area where they're trying to simplify the research and clinical testing steps so that they can start selling those products in the market more quickly without going through the safety checkup and the efficiency of these medical products. So we are still fighting a lot in order to ensure the safety of these biomedicine and medical equipment. Our area where a great struggle is going on is about regulation. And because this hospital industry is constantly trying to ease the regulations, even under the Moon administration, we are constantly struggling to stop it.
How was your union? I mean, the struggle against Park Geun-hye, the dictatorship, was a massive struggle. It's a historic struggle that you were able to bring down the government and actually jail the government leaders. How was your union involved? How did the working class in Korea to do that?
Actually, about 2,000 civil organizations formed a coalition to accomplish the candlelight vigil and revolution. And in the center of it, there was the KCTU. However, up until Park Geun-hye administration, the government has, embedded this negative image of the workers and the union so much in the people's mind. At first, KCTU was not in the front of this struggle, but took the supportive role. However, it was the KCTU and the workers who stayed until the end of the struggle throughout 4 months of the candlelight vigils, that it was the workers' class and the KCTU that led the success of the struggle. We are strongly opposed of U.S. policy to install and establish more bases in Korean Peninsula. All the labor sector is against it, and relating to the bases in Jeju Island, we have visited Jeju Island many times to struggle with others against the military bases. Every time we have new generation of leaders, we have field trip to Jeju and let them see it themselves. And we have training and education and discussions as to why we need to strongly against of the building up more military bases.
저희 미군 철수를 거기 가면 항상 외치고 있습니다.
We always demand U.S. militaries out of Korea. Well, I heard that President Trump this time is demanding 6 times more of the money from South Korea to subsidize U.S. military bases in Korea. And the sector that gets hurt the first is the welfare. The government doesn't have any other sources of income, so the government will reduce the money that they have set aside for the medical expenses, Medicare, and other welfare for the people. So that is our struggle too, to expand the health budget in the Congress. So we are still fighting to expand the budget instead of reducing the budget. However, in the face of this U.S. demand to increase the money to support U.S. bases in Korea, it is a very difficult fight.
This is an international conference. How do you see internationalism as part of your struggle and this fight of nurses worldwide. Do you think that that's important? And that's what do you think about the idea of internationalism?
I feel very proud as a nurse because I could learn that other nurses from around the country are fighting the same struggle. And we are, fighting the same injustices, but we are making, our efforts, and we exchange our struggles to learn from each other to improve the health and welfare of the people. So it is very empowering to be part of this international conference.
Thank you.
Danielle Tiplady from the Royal College of Nursing.
So, Danielle, why don't you talk about the conditions that healthcare workers and nurses are facing in Britain today?
Things for the staff in the NHS are really bad at the moment. We have in total 100,000 vacancies in the NHS. 42,000 of them are nursing vacancies. So it's a pretty bad picture over there at the moment. Over the last 9 years, the government have sought to drive us away from the healthcare service, particularly nursing. They've cut our bursary, which the student nurses, I got a bursary, which was a payment every month and my tuition fees paid at university. And they took that away and now charge up to £64,000 the student nurses have to pay to go to work.
Sounds like the United States.
Yeah. So obviously this has deterred people from going to university. The applications have dropped 29% to study nursing. They've also capped our pay. We've lost around 15% of our wages since 2010, real terms wage every year. And we were going to have safe staffing, but they scrapped that. And they've made our working conditions pretty bad. There's a lot of burnout, a lot of stress, a lot of mental health problems. So things aren't fantastic at the moment.
And the union struggle in Britain, to defend the National Healthcare Service, how is that going? Because you have now Boris Johnson, who would like to probably privatize the entire healthcare system in Britain.
To be honest, our unions are pretty weak, and their fight against it isn't as strong as it should be. We wouldn't be in the position we were in now if we had stronger unions. I think they need to up their game a bit more because, with 42,000 nursing vacancies, things really aren't going very well. And we have the most right-wing, toxic, horrible government who want to destroy the NHS. So they really need to start doing something about it.
And how has this cutback, 42,000 shortages, affected the health conditions of the people of Britain?
So with the nursing shortage, places are being closed. There's a chemotherapy unit in London that's been closed because they couldn't get any nurses. We're unable to staff wards properly, which means that, that affects patient outcomes. We're not able to deliver the care that we want to, which obviously affects people, and it affects our health as well because of the stress of the conditions.
So people are dying and not getting the care that they need to survive. They're closing these chemotherapy and other treatment centers.
It's impacting people because, like, for example, the chemotherapy place, people will have to travel a lot further to get the chemotherapy now, to clinics that are busy themselves as well. So it's a massive upheaval for them. We actually had a study, and there's been 120,000 death links to cuts, the austerity agenda, so cuts in health and social care. And what's going on is really impacting on people.
And one of the issues in the United States is the U.S. companies, healthcare companies, would like to go to Britain to so-called help out Britain. What do you think about that?
I think that they're doing a good job, and our government are helping them along the way. A lot of our members of parliament sit on the boards of the private healthcare companies, so I think they're probably quite enjoying themselves because the NHS is in a terrible state, and they've done a good job to completely grind it down.
And so you're saying a lot of students can't go into training as nurses because they can't afford it?
Yeah, saddling people with debt puts people off of, people with more diverse groups, mature students and everyone from going to university. people don't want to take on that amount of debt, and it's not like like any other degree, because you do 2,300 hours clinical work. So essentially, people are paying to work. So it makes sense that people don't want to do it, because I wouldn't have done it if I had to pay that loan, especially because it's so big. It's like up to £64,000, and our salary is so low, and basically going to end up having to pay that off for the rest of your life.
So you're basically in debt the rest of your life for getting training, which is going to help the people of the country.
Yes. I had a very small loan when I was doing my degree, and I haven't even paid any of it off. I've just been paying interest for the last 3.5 years.
You're kind of pauperized, debtors to the banks and the people who make money off healthcare.
Yeah, it's not a very good situation.
What do you think about this conference here today?
I think it's absolutely amazing. Being invited here has been one of the biggest honours of my nursing career to date. So much energy and passion and in the room, and I feel totally empowered and inspired. And like I want to go home and kick ass.
I'm Gerard Brogan. I'm a registered nurse, like my colleague Danielle. You can tell by my accent I was originally from the UK, but I've been living and working as a nurse in the US since 1985.
And your experiences what are your relationship between the United States and the UK healthcare systems?
Well, there's not so much a relationship. There wasn't, certainly when I was starting. Without going too much into history, you probably remember Hillary Clinton tried to reform healthcare. It failed. I well remember President Clinton going on TV round about 1990, putting his hands up in the air, stating, we tried to reform healthcare, we failed, let the market decide. At the time, there's about $3.4 trillion being spent on healthcare in the USA. Of course, Wall Street look at this. They're going to come in, they're going to do their, and I'm using their vernacular, their efficiencies, we know what that really means, and extract a lot of money out of the healthcare system, which they duly did. Any nurse who was working in the USA in the 80s and then in the 90s would tell you the same story. It went corporate, and it took maybe 2-3 years. I was working at the University of California, not a private for-profit company. I used to call it workers' paradise before 1990. The sea change changed all that. They become corporate, cutbacks in staffing, et cetera, et cetera. They did not need to use a profit motive, but it became the zeitgeist in healthcare in this country.
And one of the issues of the Brexit for the United States is that the United States and Trump apparently have plans to have a trade agreement with Britain.
Certainly do.
And what are healthcare a part of those plans?
Yeah, they are. As Danielle mentioned earlier, many of the current Tory cabinet, that's the government in the UK, they also sit on the boards of American healthcare companies. They're not even trying to hide this fact. So Jeremy Hunt, who was the Minister for Healthcare in the UK 2 years ago, spent a week over the bay there in Oakland, with Kaiser Permanente.
And what is he going to learn from Kaiser?
Well, what he's going to learn from Kaiser is propaganda, and their propaganda is such that they claim that they can provide better outcomes at a cheaper cost than the National Health Service. They've been working on this for 22 years. About 22 years ago, a report came out. It was supposed to be a study. The study's conclusions were Kaiser does provide better outcomes for a cheaper cost than the National Health Service. It hit the press in England, including The Guardian of all newspapers, which was a left-wingish newspaper at the time. What they failed to mention was this research was done by 2 Kaiser employees, ex-Kaiser employees. The other factor they neglected to mention was that Kaiser at the time could deny you being one of their insured patients because of pre-existing conditions. The NHS, of course, cannot do the same.
And of course, Kaiser now is coming under a lot of attack. Mental health care workers say they can't get their patients treated. They're trying to outsource and privatize in the hospitals. It seems like this is a general situation worldwide.
Yes, it is. And Kaiser is a business. It says it's not for profit. It just happens to generate a lot of excess revenue. You know, they play with words. Their goal is to become the provider of healthcare throughout the world. Sadly, They do spend a lot of their huge amount of income on PR. And again, I hate to say this.
It's not going to people's health care.
No,
it's going to
certainly not. And it's going to PR. So what they've done, they've established themselves with the International Monetary Fund, the World Bank, as the most effective way to provide healthcare. Of course, as Daniel's talked about, the Tory government, their philosophy, their political philosophy is that the private sector is much more efficient, etc., etc., etc. So they're going to welcome Kaiser with open arms. And this is a long-term strategy. It's a concerted, long-term, well-thought-out strategy.
Is that one of the reasons for this conference, to link up healthcare workers and how they're being affected by this economic?
Absolutely, Steve. We see this, corporations know no national boundaries, right? We know this, that they have no loyalty. Kaiser does not have loyalty to California. It started in California. It has no loyalty to the citizens of California. It acts like a business. It is a business. So, of course, what's their main thrust? To expand their business worldwide.
Her name is Shirley Diaz Morales, and she's from the state of Sergipe. It's up in the northeast near the Atlantic and part of Brazil. She said the government of Brazil is the biggest impediment, the biggest thing they're dealing with right now, in that it's they're having to fight to keep rights. The government's trying to push them back, trying to maintain things that have been hard fought for over the last 30 years. First off, she mentioned that they have a special retirement system for nurses in Brazil, where after 25 years of work they're able to retire, and the government is trying to undermine that and cut that back. The other one she mentioned was that they have, normally when they work on holidays and days like that they get more pay, special pay, and now the government's trying to take that away. She thinks that there will be a better future under Bolsonaro, but only if the population begins to fight back and actually do something about Bolsonaro himself. She's saying that that people are going to have to reflect on their rights, the potential loss of rights, and that when they begin to realize that these things are going to be taken away ongoingly under this government, then they will fight back, and she's optimistic about that. So they're trying to unify diverse parts of the society that haven't been together previously. Obviously, there's the labor movement itself, but she's also talking about how they're working with the students, because the students their rights are being attacked, public education and so forth is being attacked, and so it's about they're working hard to unify parts of the society that haven't traditionally worked together on issues that are confronting them.
And what do you see for the future in Brazil? Because Bolsonaro threatened to make radical change and attack the working people and poor people. What do you see for the future?
Ele está perguntando como she thinks that there will be a better future under Bolsonaro, but only if the population begins to fight back and actually do something about Bolsonaro himself. She's saying that that people are going to have to reflect on their rights, the potential loss of rights, and that when they begin to realize that these things are going to be taken away ongoingly under this government, then they will fight back, and she's optimistic about that.